Welcome London, welcome America. Video of Meghan's plastic surgery exposed. Dr. Stanton destroys Meghan, revealing to Prince Harry that Meghan came for surgical implant. Since the royal wedding of Meghan Markle and Prince Harry, Meghan, Duchess of Sussex, has turned into a commonly recognized name across the United States and Europe. Ladies were attempting to sort out what it was that got in the ruler's eyes. Meghan is a wonderful lady and has an exceptional look that draws consideration, yet she appears to be unique than how she showed up before in her profession. A large part of the adjustment of her face is her development and the deficiency of the child fat contrasted with past photographs. In any case, her nose looks unmistakably changed and isn't probably going to result from the regular maturing process. In spite of the fact that she has never conceded to going through plastic medical procedure, it is most likely correct that her nose has changed. This causes numerous ladies to talk with plastic specialists to check whether they can make their noses seem to be Meghan's. It is fundamental to comprehend that, while considering plastic medical procedure, we don't take a nose off the rack. The end product found in a specific patient is more likely than not a consequence of the previous life structures and specialists' expertise. Without a doubt, you can't regularly demand a big-name nose and have that as the normal end product. Since Meghan's nose has created a lot of consideration, it merits investigating the outcomes to teach patients who need to have a rhinoplasty method. As found in her school photographs, Meghan had a more extensive nose with what we call a bulbous tip, demonstrating that she had more width and less definition than most ladies like in their nasal shape. She had alluring dorsal stylish lines in her photographs, demonstrating that the bone and ligament had areas of strength for a line reaching out from within the temple down to the tip where it marginally flares. This is more exemplary for an appealing nose and something we frequently endeavor to do in rhinoplasty. In general, Meghan had an appealing nose, however one that could utilize somewhat more definition and refinement, particularly assuming that is what the patient wanted. Contrasting her nose with later photographs, it appears to be evident that a few changes are made to her nasal life systems. Albeit the medical procedure was rarely affirmed, there could be no alternate way for these progressions to happen. As of now, her nose seems more slender and less bulbous at the tip. The actual tip has nearly become more characterized as it doesn't mix in with the remainder of the nose's life systems. Because of the absence of help in the nostril edges, she has some gentle scoring of the edges, making the tip considerably more featured. Her dorsal tasteful lines have been changed and are presently areas of strength for not the temple to the tip. Her lines become fairly unclear at the center third of the nose. This absence of definition prompts a deficiency of the work of art, clean lines we endeavor to accomplish around here. A leftover knock stays on the scaffold from the calculated view, and afterward a plunge in the lower to mid-third of the nose is obvious.